Hello guys, welcome back to my channel, the Physio Sapien, and in this video we are going to talk about breathing exercises. So what all topics are going to be covered are the definition of breathing exercise, the goals, the various goals which we aim at achieving by giving various breathing exercises, the indications and contraindications of breathing exercise. So in which conditions you should give breathing exercises and in which conditions breathing exercises should be avoided. Okay, next are the various principles under which the breathing exercise is governed by, the precautions which need to be taken while giving a breathing exercise, the muscles of breathing, the primary and secondary muscles during inspiration and expiration, and the classification, that is various breathing exercises. And in the next video we will discuss about the various techniques, the various methods of breathing exercises, their importance, in which conditions we use them, and what it helps in improving. So all those techniques will be discussed in the next video. What is the definition of breathing exercise? Breathing exercise can be defined as the therapeutic intervention for purposeful alteration of a given breathing pattern. So it is a therapeutic intervention which helps in altering a given pattern. For example, if a person uses high amount of accessory muscles during breathing, so we can give him diaphragmatic breathing, so he focuses on the diaphragm during inspiration and expiration. Next, if for an example a person has less air entry on auscultation on the upper lobe, so we give him segmental breathing. So segmental breathing helps in increased air entry in that lobe. So according to the condition, according to the goal we have, we give him breathing exercise to alter the given breathing pattern. The next topic is the goals of breathing exercise. So what all goals are to be achieved during a breathing exercise? The first one is but obvious, to increase the lung volume. So various breathing exercises are used to increase the lungs volumes, that are the tidal volume, the inspiratory reserve volume, expiratory reserve volume, residual volume. All of these are increased with the use of breathing exercise. The second is to clear secretions. Techniques like ACBT is used for clearing the secretions present in the lungs. Next is to improve gas exchange. So the end expiratory hold. Okay, techniques like the end expiratory hold are used to increase the gaseous exchange, where you take a breath, you hold it, and there is proper exchange of the gases, and this with time it helps in improving the gaseous exchange. Next is to control breathlessness or reduce work of breathing. So better gas exchange results in preventing the breathlessness, and improving the strength of muscles also help reduce the work of breathing. So next is increasing the exercise capacity. So the improved gaseous exchange, the control on breathing, and decreased work on breathing, all this helps in reducing the load on the cardiopulmonary system. So ultimately this helps in improving the exercise capacity. Next is to reduce blood pressure, to induce relaxation response for stress reduction. So whenever a person for example has anxiety, at that time what do we suggest them? We ask them to take deep breaths and controlled breathing. So that helps them to reduce their anxiety. Therefore, to reduce relaxation response for stress reduction. So the next is to control pain in childbirth. So in a normal childbirth, the mother is asked to take deep breaths, which helps in reduction of the stress on the mother. Next is to reduce dynamic hyperinflammation of the ribcage. So hyperinflammation is avoided with the use of breathing exercise. To increase the strength and endurance of the respiratory muscles. So deep controlled breathing and segmental breathing helps in training of the muscles of respiration, which helps in increasing the strength and endurance. Next is to optimize pattern of thoraco-abdominal motion. So for men and women there is different type of breathing. So let me know in the comment section which type of breathing is in which individual, which one is in males and which one is in females. And the last one is to redistribute ventilation. So for example, there is reduced ventilation in some area of the lung. So in that condition we use segmental breathing to help increase the ventilation in that region. So all of these are the goals which we achieve with the use of breathing exercise. So in what all conditions will you use breathing exercise? Breathing exercise can be used in pain due to surgery or trauma. So following any surgery or trauma, a person undergoes tachycardia. So to relax the patient and to reduce the tachycardia, we need to give breathing exercises. Next is nervousness or apprehension. In case of nervousness or anxiety, a person can use various breathing exercises to calm himself down. Next is obesity and pregnancy. In an obese patient, minimal physical activity can lead to dyspnea. So, to prevent dyspnea and to train the individual to work under load, we can use breathing exercise. Next is bronchospasm and airway block. Same reason, breathing exercise helps in relaxation and therefore helps in releasing the bronchospasm. Restrictions due to musculoskeletal problems. So breathing exercise help in training the respiratory muscles. So it helps in improving the strength and endurance, as we have already discussed before. So it does ultimately help in relieving the musculoskeletal problems of the respiratory system. Next is narcotic abuse and drug OD, that is drug overdose. So in narcotic abuse, a person undergoes hyperventilation. So to control the hyperventilation, breathing exercises can be used. Next is CNS problems. So in various CNS conditions where the breathing pattern or the breathing rate is altered, in such conditions we can use breathing exercise. Primary or secondary pulmonary diseases. In various primary and secondary pulmonary diseases where the gaseous exchange is reduced or where there is excess strain on the pulmonary system, in such conditions breathing exercise can help to improve such conditions. Next is pulmonary pathologies like pulmonary fibrosis. So what is a pulmonary fibrosis? It is deposition of fibrils in the lungs. So thus it helps in reducing the gaseous exchange, and to prevent that or to increase the gaseous exchange in other parts of the lungs, breathing exercise can be used. Next is pulmonary edema or embolism. Similar to this, to elevate the condition, breathing exercise can be used. Pleural disorders like pneumonia and emphysema. So in these conditions also the gaseous exchange is reduced, the ventilation is reduced. Therefore, breathing exercise can be used to improve such conditions. Next is muscular weakness, as in case of myasthenia gravis. So in myasthenia gravis, there is the affection of the neuromuscular junction in the body, and the later stage of myasthenia gravis results in respiratory failure. So to prevent that from occurring, we need to give breathing exercise. To prevent in cases of respiratory failure, we give breathing exercise. Prolonged bedridden conditions which could lead to hyperventilation. In case of bedridden patients, the patient is mostly in the supine position. So that reduces the expansion of the lungs and thus results in increased rate of breathing, which could result in hyperventilation of the lungs. Therefore, in such conditions, we need to teach the patient to have controlled breathing to avoid hyperventilation. So all of these are the indications for giving a breathing exercise. And next, coming on to contraindications of the breathing exercise. Breathing exercise is considered relatively safe in almost all conditions, but in certain conditions they are to be avoided or to be used safely with precaution. So such conditions are unstable hemodynamics, where there is not adequate blood supply in the body, that is, the body is in a possible shock. In such conditions, the breathing exercise should be used with precaution. Next is acute respiratory distress. So if the patient is in acute respiratory distress, at such time breathing exercise should be used with precaution. In untreated pneumothorax, the breathing exercise is contraindicated, as the untreated pneumothorax can spread with the use of breathing exercise. Recent spinal surgery. So if there is recent spinal surgery, there is less expansion of the rib cage, okay, or else if you are going to expand it more, then it can put a stress on the spine. Therefore it should be avoided. In active hemoptysis, that is blood in the sputum. In rib fracture, breathing exercise should be avoided because it can result in displacement of the fracture. Next is conditions that increase intracranial pressure. So in conditions where the intracranial pressure is increased, we should avoid breathing exercises which causes hyperventilation. As due to hyperventilation, the amount of carbon dioxide in the blood reduces, which can cause vasoconstriction in the cerebrum. Therefore, in conditions like increased intracranial pressure, we should avoid breathing exercise. Next is the muscles which are used in respiration. So these are the primary muscles and the accessory muscles. So the primary muscles are used in quiet breathing, that is normal breathing, while the accessory muscles are used during forced inspiration and expiration. So when you are exercising or you are breathless, at that time the accessory muscles are recruited. So under primary muscles, during inspiration, diaphragm contributes to 70 to 80% of the total force of inspiration. It is also helped with the parasternal fibers of the intercostal muscles and the scalene muscle. And the expiration is a passive process. So no muscle is acting during quiet expiration. Next is the accessory muscles. So during forced inspiration, the sternocleidomastoid, trapezius, pectoralis major, pectoralis minor, subclavius and serratus posterior are recruited so that the rib cage expands, and thus the volume of rib cage increases, thus lowering the pressure. Therefore, the air entry is from outside to the inside, that is from high pressure to low pressure. Thus, all these muscles helps in forced inspiration. Now coming on to forced expiration. Forced expiration is done by the abdominal muscles, which are transverse abdominis, internal and external oblique abdominis, and the rectus abdominis, which are also helped with the transversus thoracis, and the gravity acts as a accessory force for forced expiration. So all these muscles are used in forced expiration and all these muscles are used in forced inspiration. So all of these are the muscles which helps in the quiet breathing as well as in forced breathing. Classification of breathing exercises. Breathing exercise can be classified into inspiratory exercises and expiratory exercises. Inspiratory exercises helps to improve the lung volumes and capacities. It can be remembered by the mnemonic SD Desi Sigma. So S stands for segmental breathing, D stands for diaphragmatic breathing, deep breathing, end inspiratory hold, stacked breathing, incentive spirometer, shifting, that is air shifting, inspiratory muscle training, glossopharyngeal breathing, mobility exercises and abdominal breathing. Next is expiratory exercises, which can be used for two reasons, that is to remove the secretion and to reduce the work on breathing. So the exercises which are used to remove the secretions are ACBT, autogenic drainage and forced expiratory techniques. And the exercises to reduce the work on breathing can be remembered by the mnemonic BPTh. So B stands for breathing control, pursed lip breathing, hold, that is end expiratory hold, abdominal belt, active expiration, and pacing, that is breathing controlled with some activity. So this was the classification of breathing exercises, and in the next video I will be teaching you each one of them separately, how to perform them, what are the indications in which you will perform each one of them, and what changes do these bring in your body. And in this video we had discussed about the basics, that are the indications, contraindications, principles, the muscles used in ventilation, that is respiration. And that's all for this video, and hope you have understood it properly. Share it with all your physiotherapy friends and let me know in the comments if you have any sort of doubt. You can also check me on Instagram @thePhysiosapien and DM me any sort of doubts or any problems you have. This is Ronak Chandak signing off.